Welcome back. Health Tuesday continues. Thank you for choosing KBC Channel 1. This is the best place to be each and every morning. This is Good Morning Kenya. If you've just joined us, it's all about matters health this morning. And I am joined in studio by three guests. Towards my right is Evelyn Kibuchi, the Chief National Coordinator for Stop TB Partnership. And in the middle, I'm joined by MP for Mutungulu, Honorable Stephen Mule, the Chairman of the African Parliamentary TB Caucus, a National Parliamentary TB Caucus. And towards my father's right is Dr. Kamene Kimenye, the head of the National Tuberculosis, Leprosy and Lung Disease Program. Thank you very much for joining us this morning. Now, I would like to ensure that you tweet at KBC Television, at Ram Aguko. The hashtag is Good Morning Kenya. It's all about tuberculosis because TB right now, it is currently one of the top 10 causes of death worldwide. Now in Kenya, it is the fourth leading cause of death. Note that this disease affects the people of different age groups, but it has the greatest toll in the most productive age group of 15 to 44 years. So this show is about you. So do not go too far. This is something that you would not like to miss. Now, as we start, some may not be able to understand why it is the leading cause of death within the country. Let me start with you, Dr. Kamen. What makes TB very dangerous?
Thank you very much for the question. Interestingly, TB is the one disease that once you get, you can live with it for a long time before you actually, you get infected and it takes long for you to get infected, to get actually the disease. And when you develop the disease or you start having the symptoms, many people miss it because it will have symptoms like cough. And then when you have cough, people think it's a cold, you go and buy a cough syrup. The next you go to the clinic, someone gives you treatment for pneumonia. So it might take so long for people to know. And by the time they have discovered that this is TB, you might be too sick. So there are reasons why TB is always or most of the time missed. And that's why we are encouraging everyone to be screened for TB when they go to the hospital. So that we pick it early and we treat it early.
All right. Yeah. We will come and talk about the symptoms later on because TB, at some point, as you said, someone may not be able to recognize whether it's just a normal cough or not. Now, Mheshimiwa,
yes.
As a country, how far are we when it comes to eradicating TB?
Thank you very much. I believe that we are on the right track. Quite a lot of work has been done, both at the TB program and also in Parliament. Basically, you know very well, we amended the Health Act and Health Bill so that we can accommodate most of the diseases which have been neglected for a while. And I think as members of Parliament, we play a very key role to ensure that the department has enough resources, because Parliament is a budget-making body, and we are the people responsible as members of Parliament to make sure that they have enough resources to deal with the tuberculosis in the country. So as a country, we are quite well in the right track, and I believe that sooner or later, we should meet our target of ending TB 2030.
Interesting. How far are we in terms of awareness? Are we well equipped and well aware about the cases that tuberculosis can, how far it can go, how much damage it can cause?
Thank you. That is actually, lack of awareness is one of the challenges that has made tuberculosis remain one of the leading killers. Because most people are not aware the symptoms that, in the first place, they think that TB was eradicated maybe in the 70s. They do not know that we still have TB. Two, most people do not know about the symptoms of TB, and they mistake the symptoms of TB for very many other diseases. That's why they do not seek treatment. That's why they do not seek treatment early. And there's also the issue of awareness and stigma. People are aware, some people who are aware about TB, but the stigma is very high, and stigma stops people from seeking treatment because they're afraid that if I go to hospital, I'll be known that I have TB. And the reason that there's high stigma for TB is because of the relationship between TB and HIV. That HIV is a predisposing factor for people to get infected by TB. And I'm sure Daktari is going to talk more about the relationship between TB and HIV. So awareness is very, very low among the population.
Now, what are the reasons why people are not quite aware of this? Because we have people dying, so many, worldwide. Could there be something that is preventing this kind of awareness from taking place? Are we the ones who are not talking about it as much as we should?
One of it, you have just mentioned, that we are not talking so much about it. But the reason that there is low levels of awareness is because before the emergence of HIV, we were almost getting rid of TB. And so much effort was not being put in addressing TB. But when HIV came to the scene and it increased infections of TB, then there was need to invest more in TB. But that has not happened. But we are happy that now the world has awoken to the fact that we need to invest more in creating awareness. And if I may answer your question as why are we talking about TB today? I'm sure you must be following about development globally. And at the global level, we have the world development leaders makes plans for 15 years. And the previous plan that ended in 2015, what we call the Millennium Development Goals, of what we popularly called as MDGs. By the end of the MDGs, these leaders reviewed how far had we achieved the targets that have been put for the different development areas, including health, security, food, and all that. And for TB, in some areas we had achieved the targets at the global level, but in others we had not. And so when they reviewed the Millennium Development Goals, they formed new targets, what we call the Sustainable Development Goals, that will run for the next 15 years. Remember, MDGs ended in 2015. So we started a new strategic plan that started in 2016 to 2030. And so in the Sustainable Development Goals, the target for TB is ending TB by that year of 2030. So for us to achieve those targets of the Sustainable Development Goals, then we have to put more efforts towards ending TB. And one of it is investing more in creating awareness.
Let's talk about investing more in creating awareness. Funding within the country. It was just the last year in July that we had the first tuberculosis patient cost survey that was launched, and during the launch the CS for health, that is Cecily Kariuki, had said that they are having plans to include TB treatment in the NHIF benefit package as a way of funding treatment locally. Now in terms of funding, are we having sufficient financial support from the national government or even from the county government when it comes to dealing with this epidemic?
Thank you very much. From the national government, we are doing as much as possible to make sure that at least we have enough resources. It's very interesting for some of us who are seated here, we know where we have come from. Probably we have come from zero budget, which is the truth of the matter, sometime 4 years ago, to levels whereby Dr. Kamene can be able to put up a budget within the department and also through the ministry, and they procure some goods. But you also need to understand tuberculosis, HIV, and malaria. It's also funded through Global Fund. And as Kenya, we have been a beneficiary of Global Fund for a while. So the resources are there. But I want to give you some facts which are a bit interesting. The impact of TB, not only in Kenya, but in the entire globe, we are talking of a disease burden of $3 billion. So if you divide that across the entire world, the burden is quite huge. So there is need for increased investment from different countries, from donors.
Can we handle it?
I believe from the last meeting we had in New York, that is the UN high-level meeting.
Even the president was in attendance of that
And the
meeting.
president was in attendance, and there are commitments which were done. If the globe follows the actual actions which have been put in place, by 2030 we should be able to handle this burden. But there is increased scientific requirements need to be done. That is the vaccines, development of new vaccines, development of new remedies to deal with the scourge. And also what Dr. Kamene has said, we need to screen everybody. I believe it should not be done as a choice, should be mandatory. You know, this word, sometimes you need to be out of touch with the normal life and move to extra box of making sure that you do the right thing.
It should be a must.
It should be a must. For me, if a must, and if any requirement needed in the floor of the house to be passed, we should screen everybody for TB in this country, if we need to deal with the menace.
Okay. Now, but in terms of now getting the financial support to the county governments there, do you see it happening?
I believe what we need to do, we need to engage the county governments a lot. And last year I proposed that we need to have a health summit, which I believe it will be the core addresser of most of the things between the national government, the county governments, the stakeholders who are involved. And when we talk about health summit, is that we are talking about putting awareness to the governors, the scourge and the levels where TB is in their counties. The health summit will bring up people together. That is the COG, that's the Council of Governors, the Committee of Health at Senate, Committee of Health in Parliament, the Minister of Health, the players like the department, the donors, so that we can move together as a country. But that has not happened. I believe that we are still on the drawing board to make sure that we have a health summit, which is I believe will be the key. And basically what we need to move fast is to make sure that we support the department financially from the national government to make sure that they start screening of people. And I believe that plans have already been put in place. I don't want to let the cat out of the mouse, the box early enough, but I know sooner or later you'll be seeing screening county to county. But also for the county governments, and if governors you are listening to me, when you get money from the national government, please reinforce money for some of these diseases. So that we give you money to deal with TB, don't go and buy vehicles. Why should you buy vehicle? A vehicle is a transmitter of TB.
You would make me want to come there, yes, where money allocation issues.
Yes.
But I'll come back there. Dr. Kamene, what are the signs and the symptoms of TB? You've, just as you had mentioned there, about confusing a cough with TB.
So yeah, thank you. So cough generally is the main symptom of TB, and 80% of the people will have TB in their chest. They stay in the lung. That is what we'd call it in the medical terms, but for all of us would say, yeah, I have a cough. The other thing is that I'll start having sweating at night. I sweat a little bit more at night than normal. So at night maybe you feel a bit hot, but you're sweating more. You start having hotness of body. That's what people would call fever. I'm feeling hot. That's what they would say. And then they have pain in the chest. Those are the most common signs of TB. Of course, there are others depending on if you have TB in the chest or other places. You might have back pain, inability to walk if the TB is on the back. And other places, like if it's on the neck, where you have, they say you have tonsils. You know, that's what they say. But it's a swelling on the neck. So you also have those, but those ones are rare. But the most common is the one which is that is from the lungs. From the lungs. Yes.
Now, is TB treatable?
TB is treatable. That's the beauty of TB. Though it is killing majority of the people, that beauty is that it's treatable. Yes, once you're seated on treatment, we do expect that within 6 months of taking your treatment, you'd be cured. So treatment generally is 6 months. So from the start to the end, you just 6 months, but you take it daily, and you'll definitely get cured.
All right. But now there is an aspect of monitoring your state as a TB patient. Is it possible for someone to monitor themselves when they have TB?
So when one has TB, the most important thing is first get to the clinic. You're given clinic days in TB that you come at the beginning it's every week, and then thereafter, after 2 months, you start coming once a month. You're given treatment for 1 week, drugs for 1 week. The most important monitoring is for you to swallow your medicine. And if you feel uncomfortable, for example, you feel your body is getting weak, or you're vomiting, or you're having some form of side effect, you go back to the clinic. That's the monitoring that is expected. Then when you go back to the clinic, they'll check you. The clinic ensures that you're getting better by testing for your sputum, kikohozi. You remove kikohozi, we check whether you have the bacteria still in the kikohozi, and we do that at the beginning at 2 months, and then 5 months and 6 months, so that we just monitor you. But for all you need to do as a patient, take your medicine as advised. 2, come to the clinic as advised. And 3, if you are feeling that you're having anything that might be, or you're reacting to the medicine or something, just come back to the clinic and tell the clinician.
There's something that she had mentioned earlier on about HIV. And TB is, for HIV patients, TB is like a killer, main killer. What is the relationship between TB and HIV?
So I could take us back to the basics when we were young, and when we went to school and we were taught a bit about science, and we were told that we have something called the white blood cell that improves our immunity. So when you have HIV, what happens, it tends to reduce that immunity, ability to fight disease. And so if you already had an infection with TB, then it becomes easy for you to develop the disease, or for you to start having the symptoms of TB, because HIV reduces your ability to fight the TB that you might be having, or a bacteria that might be in your body.
So when TB comes, it completely destroys everything.
Yes, but if it's picked early, you will still be treated and cured. Whether you have HIV or you don't have HIV, you will still be cured once you're put on treatment. The advantage is that we have also discovered that you have the ability we are able to prevent TB in HIV patients. So we're also screening HIV people to ensure that if you have HIV, we put you on treatment to prevent you from developing TB. So there's an advantage of us screening you early, and then we prevent any HIV person from developing TB. It's important to note that not necessarily, or rather majority of the people who have TB now do not have HIV. So we want to start teaching people that even if you have TB, does not mean you have HIV. And I think that's an important message for everybody, because majority of the people are afraid to know their TB status because they're also afraid they might be having HIV, and that is not the message we want to pass.
Quite interesting there.
Yeah.
Now, as you mentioned about the screening, about all those, it makes me want to know, do we have enough human resource when it comes to handling this?
I would say there are so many gaps in TB response, not just human resource. I'll start by saying that now that we all have these new targets of, let me use the word eliminating, although we use the word ending TB. Now that we have the target of eliminating TB, it means that we have to start doing things differently. Because if we continue doing the way we have been doing for the past so many years, then nothing is going to change. And the new things include, 1, putting more investment in all spheres of TB response. That means increasing investment in human resource. Because if we are saying we're increasing, if we are testing more people, that means we shall have more people who will go to the facilities.
Yes.
That means we need more human resource. So the same nurse who has been sitting in that facility now will be receiving maybe double the number of people that comes to her. That means she'll be overburdened. That means that we need to have more human resource capacity. We'll need more more equipment for diagnosis. We'll need to increase treatment, drugs, because if people are found to have TB, then they'll need to be put on treatment. So we have to increase funding at all levels if you're going to attempt to achieve these targets. And let me talk about levels of funding. I know Mheshimiwa has mentioned about a global fund. We have 3 levels of funding when it comes to TB. The first one comes from the global sources. We have what we call global fund. Global fund is a fund, let me put an analogy of a pot.
It trickles down.
It's a pot which so many donors put money into it. That's a global fund.
Right.
So we have the US, the UK, the French government, the German, they put money into that one pot. And that pot, then now it trickles down to the countries that deserve this funding. And TB, HIV, and malaria in Kenya benefits quite largely from that pot of global fund. And right now, this year, these donor countries that I've mentioned will be meeting to discuss how much do we want to invest in these 3 diseases for the countries that deserve it. And so one of the message that we are calling the donors now is that we need them to increase funding, because we are edging towards the end of these diseases. And that is the time we need more funding. Let me come to the national level now. Every year, we keep saying we need more investment to TB. But now we even have more reason, because we have these very ambitious targets that we must achieve. So I am sending this message to Mheshimiwa Wamule and to the budgeting committee that will be sitting to do a budget for the next financial year. Consider increasing your funding to tuberculosis, because we have a very huge funding gap. I know Dr. Kamene always survives on a very, very shoestring budgets. So we need increase.
Do you?
Yes.
Yes.
I'm so happy that she's talking about it.
We have a huge, very, very huge funding gap. And let me come to the county level. Health is a devolved function. It therefore means that the county government must own the health of their people. And how do they own if they are not putting investments in health? And because we are here talking about TB, and because we are here talking about a disease that is killing so many Kenyans per day, then the county government must, in their financial budget, increase funding to TB. And let me come now to the final level. Much as we are telling all these bodies to increase funding, we know they have so many competing areas. They will say we have food to fund, we have forest, we have agriculture. Priorities. But we have this untapped source that is not talked much about, the private sector. And they don't even have to put so much money. They just need to see what is their core competence that we can tap into and address some of these health issues. For example, let me give an example of Safaricom. They just need to say, when we are sending that message, that I've updated your credit, down there, give a message on TB. It does not cost Safaricom any money, yet it goes a long way in creating awareness.
Someone may not even put to claim that it is a form of advertising, so you should pay in a way.
No, it's their contribution towards these health goals, right? If I look at the transport sector, for example, we just need the matatu owners to say, we are going to create awareness to our own passengers, to our own clients. We're going to put stickers, open the windows, or these are the symptoms of TB. It will cost so little, yet it's going to go a long way. So we're also calling other sectors to see what is it that we can contribute in the fight against TB.
Mheshimiwa, how far are we when it comes to facilitating and engaging in partnerships for TB action globally and even nationally here locally?
First and foremost, as you put it very clearly, I'm the chair of the TB Parliamentary Caucus in Africa and vice globally. First and foremost, why members of parliament came together is that there was no awareness within even parliaments. And within parliament and within government. And I remember last year in January, visited New York and visited quite a number of ambassadors at United Nations. And when you mentioned TB, they were shocked. We had figures from different numbers. So basically, as globally, we have 2,000 members of parliament who speak about TB today. We started when we were 5 of us, less than 4 years ago. Today, Parliamentary TB Caucus is the largest group of members of parliament globally. We always have meetings. We had our last meeting of last year, and we have done very well because in the first place we championed for the agenda of tuberculosis to be put on the United Nations high-level meeting, which happened already, and governments came on board to commit themselves. Now, it's the duty of us as members of parliament to follow those governments and those commitments from parliament. And in Africa, I'm quite happy because we have launched quite a number of caucuses within African region. And I know within the next probably 6 months, we are going to launch caucus in Lesotho, South Sudan, Rwanda, and probably Namibia.
Do we have leaders from those countries?
How we operate is that every country, the moment they launch their own caucus, there must be a key point leader. within that parliament. It does not matter which side of affiliation of the government you are. You are a member of parliament and you are championing about TB.
And within the 2,000 that you've mentioned,
yes,
members,
yes,
they are from different countries.
They are from different countries.
Ambassadors.
Yes, they are all our ambassadors. And Kenyan TB caucus is the largest globally. The members of parliament in this country have embraced the entire issue, and I know they talk about TB even in their meetings within. And also, something very interesting we need to bring back at the constituency level. You know, when we were fighting HIV, we had what used to be called CAC, Constituency AIDS Committee. So these committees, what we have agreed with members of parliament is that as they discuss HIV within the constituency level, you must talk about TB. And that is the message we want to put to all members of parliament. It is the high time we stop the politicking of the day, every day, and we also pick up issues which affect our people. Because today, if you look at the numbers, and I know Kamene will give you the numbers of Kenyans who die of TB in the country in a year, you'll be shocked. We are talking of 60,000 Kenyans.
Actually, I do have those statistics here,
yes,
and it's something that we will tackle, because there has been a decline at some point of TB worldwide, according to some statistics. But in Kenya, it is from 10,000 in 2015 to 4,000. I don't know if it was 6,000 before, as he has alluded there, but there was a resurgence in 2017 with 9,081 deaths, according to the Economic Survey 2018. How can we be able to reduce these numbers?
Okay, so maybe first of all, I'll talk about the numbers. There are two numbers that we have. We have numbers that are based on the people who actually started on treatment, and that's a very big, small denominator. So in Kenya, we start around 80,000 people on treatment, of which around 5 to 10 die. But the ones who actually die in the country, in the population in a year, is around 60,000 per year.
Wow.
Yes. So between 58,000 to 60,000 people die of TB every year.
Now,
you can imagine the Kasarani Stadium full of fans. It can hold 60,000.
Yes.
You wake up and all those guys inside Kasarani, people are dead. What will be the reaction in the country? A calamity. But it's happening and there is no calamity.
no one is even concerned.
Nobody is bothered. We are just talking it passively and whatever.
But even as a leader,
yes,
you are in the parliament.
Yes.
She mentioned something here about prioritization of funds.
Yeah.
How is it that you're dealing with it? Prioritization of funds.
I want to thank the Health Committee, which I served last parliament and which I'm serving in this parliament. When we picked up the issue of TB, it is unfortunate there was very little allocation to this vote. And as a Health Committee, we made a very clear message to the Minister of Health that we are not going to discuss any health budget for health if we don't have sufficient enough money for tuberculosis. And they are my witnesses. For the first time, they got money at least to buy simple things to make sure that the departments run. Today,
for the first time?
Yeah, for the first time.
You never had any funding at all?
We had very little funding for drugs, mainly.
Yes.
Especially from the national government.
Yeah, especially from the national government.
And at the moment, is it
It is increasing. We have been increasing. We started. I remember that time we were in a very deep crisis. We were forced to borrow TB drugs from our neighboring countries, and we put in about 100 million at a go. And then, as we speak right now, I know very well, and at the last budget and the budget coming, the department will receive more than 400 million from the national government. That's a substantial increase towards. And I believe with that increment, it has made a difference.
Now, in terms of coordinating between one county and the rest and others, do you have some counties that you're finding it difficult to create awareness of TB?
Let me first say about the counties that different counties that they're at different levels of TB. But we have the 10 counties that have the heaviest burden of TB in the country. And as far as accessing and creating awareness in these counties is concerned, it largely depends on, one, the commitment of the leadership in that county. 2, other stakeholders that are present in that county, and 3, the commitment in funding. So if the county has not allocated enough funding to tuberculosis, then creation of awareness and even other services will be in jeopardy. But if we have a county that has that puts a lot of investment, or we have other stakeholders, other donors in that county, then it becomes easier. So my message to the COG, and I know Mheshimiwa talked about trying to reach out to them through a summit, is that TB is just a breath away, right? And today TB, it will be in Nairobi County. Tomorrow, that TB, the person with TB, will move to Kiambu. Tomorrow they'll move to Nyeri. The other day they'll be in Migori. So we have to have the same level of response across all the counties because of our mobility and because TB is just a breath away. We cannot afford to have one county investing more than the other. We need to look at it holistically as a disease that affects Kenyans and that it can be passed just through breath.
What challenges are you facing so far when it comes to TB patients?
So the biggest challenge with TB patients, first of all, is diagnosis for most patients. So you realize that we have certain sites that can diagnose TB, and so far we have at least but around 206 that can diagnose TB and also surveillance. Although we have others that can do using microscopy, which is not the most sensitive test, around 1,800 facilities that are able to test. However, the bigger challenge is children. You can't test children. They are not able to produce the sputum. So those are challenges. The second challenge is prevention. I wish we had a vaccine, but where we don't have vaccine, I wish we are able to procure as much drugs and screen as many people as possible, give them preventive therapy so that we don't have to develop.
So for the kids,
disease.
there's nothing that can be done there?
We are now learning how to use, to improvise ways of getting the sputum from the children. And also trying to do some studies to see whether we can use stool and urine to test children. The other challenge, of course, is I wish we had an easier drug to take, not take treatment for 6 months. But thankfully, at least we have the treatment for those 6 months. But if we had something that would take a shorter period, that would be nice. The other very big challenge, I'm sure, we have to talk about is resistance to treatment.
From who?
We are now developing resistance to the available TB medicine. You know, as in, I give you the drug, but the bacteria you have cannot respond to this drug. So you continue being sick. So I have to give you a different drug for you to heal. And the drug is more expensive.
Do you have issues of misdiagnosis?
Yes, sometimes. Sometimes, especially when you have cancer. Like someone has lung cancer and they're also coughing. So is it cancer, is it TB? So sometimes we have those challenges of misdiagnosis sometimes, but they're not the most common challenge. The other thing is, of course, as we have all talked about, is awareness. Awareness not only in the community, but also even in the health facilities. Why? TB, we had almost eradicated TB if you think about it. So right now you have to re-educate the whole healthcare system to remember that there's a possibility that the person sitting next to you will have TB. The other one is infection control. What I mean is, TB, you just need to be breathing and the guy next to you has TB, coughs, and you get it. How do we ensure that we prevent that person from transmitting to you? We have the matatus, we have crowding places, we have poor housing. Majority of people don't have proper housing. So if the child is living with a mother who has TB, the chances of transmitting to the child increases.
How can TB be transmitted from one person to another?
So TB is basically transmitted through when someone who has TB coughs, and then they cough, they release the bacteria into the air, and the person who was nearby breathes in the bacteria. So it's as simple as I cough, you get. You get what I mean? And you're just breathing. So that's as simple as that. At night, people close windows. In matatus, we close windows. So that's a big challenge.
Yeah, I want to add on a challenge that she has brought up.
Yes.
The issue of drugs that have taken for 6 months, no vaccine. The issue of problems in diagnosing TB in children because you cannot tell a 3-month-old baby to remove kikohozi. She can't. So it's very difficult to diagnose. So what can be done to address these problems? we need to look at research, right? If I look at the much research that has been done in HIV since it was reported in 1980, and look at the equivalent of what has been done in TB. In HIV, there has been so many products. Oh, there is PrEP, there is PEP, there is
Post.
the post. Yes, there is this kit that you can
The
test
self kit,
yourself.
the oral kit.
Yeah, the oral
Nowadays,
kit.
people can do it at the comfort of their home.
Exactly, yes. And there's research for a vaccine. There is, they call it the microbicide.
Okay.
Yeah. What I'm trying to say, there's so much investment in research regarding HIV, but the same is not happening in TB. The same drug that was being used in that 1980 for TB is the same one that is being used today.
There's no improvement.
There's no improvement.
Since
The
1957.
BCG.
Since 1956.
Exactly. And why is that so? Is it that we don't have brains that can do research? No. The brains are there. I'm telling you, Kenyans have brains and they've been doing research. But if research is not funded, then how do they get the resources to go to the laboratory and test this vaccine and test that drug? They don't have drugs.
Yet then it is a dead end thinking that we can be able to end the tuberculosis epidemic by 2030 if you use the same drugs.
Thank you so much. Yes, you're thinking like you're a
us.
global leader. Now, in one of the commitments that the president made in New York was to increase funding to research and development for TB-related products, so that we can have a vaccine, we can have a drug that is taken for a shorter period. So I am looking at Kenya. How much will they invest in research for health in the upcoming budget? Mheshimiwa, I'm looking at you. We must increase those funding so that we can have newer products coming to Kenya. And there are some that are in the laboratory, they cannot move forward because there's no resources to move to the next phase. So let's think about research.
Even as you talk about research, I would like us to wind it up. And Mheshimiwa, I would like you to tell me how far as a country are we, even when it comes to coalition amongst organizations, because she has alluded to research. Does it mean that we have some division between one organization, one entity or another, even when it comes to even within the civil society, organizations and communities with regards to eradicating this? How far are we as a country? Are we heading towards the right direction? Is there some discomfort of this unity somewhere?
I would not allude any discomfort. What I want to say is that we need to think outside the box. We have one of the most well-structured research institution in the region, that is KEMRI. And I think it's the high time the leadership in KEMRI and within the universities, that is University of Nairobi, Kenyatta University, and the rest, think more on how to put their heads together on towards research. I believe KEMRI has done quite well for over the years on terms of research of different products. And I believe that if proper resources are channeled through KEMRI and the scientists within this country are given the opportunity to put up their proposals and their proposals are looked at, we should be in the line of the teams whereby we are looking at the research holistically as a country. But also that calls for enormous resources, whereby we need to balance. I think one thing which we suffer a lot, and as Parliament, is that how to balance the request of the amount of money required. You can never have enough. But I believe that last year when we were doing the budget, we were very keen as a health committee to request scientists to put forward their request for funding. We also need the Minister of Education to come on board, because you find some of these researchers are more based and inclined in the Ministry of Education, because they are they are in the learning, the teaching institution in this country. So it's a matter of the Minister of Education, Minister of Health, the research institutions come together and form a multi-tax committee, or what President Moi used to call formed this committee, tax force.
All right.
to look at this. But I agree with Evelyn and Daktari that the key, not only to Kenya, but to the entire world, is extensive research, and I know it will happen.
Now, as we are winding it up, let me give it to you. We have the universal health coverage and TB. How are we including these complaints that we're having within the universal health coverage and dealing with TB at the same time?
Yeah, thank you. I want to look at universal coverage
within 1 minute.
Yes, as a component of the big four for the president,
Yes.
which include manufacturing, housing, food and nutrition security, and the fourth one is UHC, right? And I want to say that if we are able to implement these four, then TB will just easily phase out. How so? If you look at housing, improving housing means that you're building houses that have better ventilation, that are spacious. And remember, TB thrives best in environments that have no proper air circulation with no proper lighting. So if we improve housing, then automatically we will cut TB infections by a very huge proportion.
Right.
Number two, food security. TB affects people with low nutrition. Malnutrition makes people become more vulnerable to TB. So if we addressed food security among the population, then again, we lower the TB infections. And UHC, if we invest in UHC, that means everybody can access diagnostics, can access TB treatment, can access health services. And that means those who are found positive, then they get the right health services. So we look at TB as a development issue within the four big agenda. And if they're implemented, then we shall end TB.
Thank you very much. This discussion is something that we can keep on talking about it, because we have a TB Day, the event, which will be in
24th of March.
So let's keep this conversation going on our Twitter handle at KBC Television, at Ram Aguko, at Jane Wambui, and at Ray Manyara. The hashtag is Good Morning Kenya. Remember, by 2030, we are expected to end this TB epidemic worldwide. That's according to the target by the Sustainable Development Goals. Together, let us end TB. As for me, I would like to wind up the show. Good Morning Kenya has been awesome having you on board. Let's meet again tomorrow for another segment, another edition of Good Morning Kenya. God bless you. Have a blessed day.
Have a